At 4 months old, every move Anaya Porter makes is a miracle.
You go day by day. Is my daughter going to stop breathing? Is she going to stop attempting to stand up? Is she going to stop putting her head up?
Anaya was born with a rare genetic disease called spinal muscular atrophy, or SMA. It progressively kills motor neurons, the nerve cells in the brainstem and spinal cord that control essential functions like talking, walking, swallowing, even breathing.
We live every day like wondering and hoping that nothing else happens to her, that she doesn't lose any more of her motor neurons.
There is treatment. In 2019, the FDA approves Zolgensma, a drug that carries a price tag of $2.1 million.
The SMN1 gene is very important.
It's a one-time gene therapy given through an IV designed to replace the function of a missing or defective SMN1 gene in a patient to stop the progression of SMA, preserving motor neurons before they're gone.
It doesn't give back what she has already lost, so that's why it's so time sensitive.
Get your feet. When Anaya's doctor prescribes Zolgensma, Haley Weiss and Will Porter say their daughter's insurance, a Medicaid provider in Texas, denied coverage.
She got the denial from her insurance, and that was devastating for us.
As they appealed, they say Anaya started to show signs she may lose control of her muscles.
She stopped having reflexes in her legs, and then her tongue started twitching.
Racing against time, Haley connected with other families of kids with SMA and a lawyer who agreed to represent Anaya for free.
All the doctors agree Anaya Porter should receive this treatment.
Eamon Kelly, a Chicago-based attorney, says Anaya is the 7th child with SMA he's represented in insurance coverage battles. In Anaya's case, he says the insurance plan provider said the treatment was not medically necessary because doctors believe Anaya has 4 copies of what's known as a backup gene, which can indicate a milder illness. Kelly argued backup genes, along with other available therapies, would not be enough to keep Anaya from losing muscle function, but cutting-edge gene therapy could help.
We have a treatment that will take a little girl that is going to have a degenerative disease that threatens her life, that will put her in a wheelchair. And as long as we get it to her before she's 2 years old and before she loses her motor neurons, she'll walk, she'll dance, she'll live a full life. It's like science fiction.
The first child with SMA Kelly represented is Maisie Forrest, who received Zolgensma in 2019 when she was 20 months old. Before getting the drug, her mom says Maisie was on a ventilator 22 hours a day.
We met with her pulmonologist, and I just wept. I told him she's not going to make it till 2. And he didn't offer any words of hope because he knew Maisie was on the decline as well.
Maisie is now 4 years old.
She touches my face, and it's absolutely beautiful.
She's playing, talking, and crawling.
Something that I have now that I didn't have was hope. Hope that I will get to see her continue to meet milestones that she was never supposed to meet.
Maisie's mom and a team of volunteers known as Maisie's Army introduced Anaya's parents to Eamon Kelly. And last month, Kelly represented Anaya at a Medicaid state fair hearing. Anaya's family requested the hearing from Texas Health and Human Services after receiving the insurance denial letter. A week after the hearing and a few days after NBC5 Responds reached out to Anaya's health plan provider, Superior Health Plan, Superior told Anaya's family Zolgensma would be covered for Anaya.
We have fought for 4 months. It's been the longest 4 months of our lives.
On April 27th, Anaya's family made the trip from their home in Abilene to Cook Children's in Fort Worth, where Anaya received the drug.
She's going to sit up on her own. She is going to walk one day. She's going to feed herself with a spoon. She's going to walk down and she's going to get her diploma.
NBC5 Responds reached out to Superior Health Plan by phone and email. We didn't hear back. We asked Texas Health and Human Services about options for families denied coverage for Zolgensma. It shared in part, Medicaid covers medically necessary services, including medications, and those services are delivered through managed care organizations. If the prior authorization is denied, the provider or member can appeal the decision, and MCOs have flexibility to make medically necessary decisions. It also says members have the right to a state fair hearing, and Medicaid covers alternative therapies for SMA. A spokesperson for Novartis, which makes Zolgensma, tells NBC5 the one-time gene therapy is priced based on the value it provides to patients, caregivers, and health systems, and that it's working in partnership with governments and healthcare systems worldwide to identify and define new sustainable access models.
We just knew we couldn't give up.
Anaya's parents say they're now focused on helping other families get access to a drug they believe is priceless.
I don't care how expensive it is. It's a child's life. Every baby deserves a chance.
In Abilene, Diana Zoga, NBC5 responds.